Hi everyone. Very happy to see you all with another topic of bone pathology. We are going to discuss about Paget's disease. This disease is also known as osteitis deformans. We are going to discuss this disease under the following topics: the pathogenesis, morphology, clinical features, complications, diagnosis, and its treatments. Let's move into it. Paget's disease is actually a skeletal disorder where there will be an increased bone mass. The bones will be disordered and structurally disoriented. If we see about the epidemiology, firstly age. This Paget's disease is most common in increased age over 50 years of age and also in late adulthood. That is around 60 to 65 years of age is late adulthood. Then gender, males are most commonly affected. Looking towards the pathophysiology, we acquire this disease through genetic means, that is through mutations, and through infectious means, that is through infection of microorganisms like bacteria and viruses. Let's see about the genetic causes of Paget's disease. There will be a gene mutation seen in Paget's disease and the gene is SUSTM1 gene, which is also known as secostosome 1 gene, which is getting mutated here, which causes NF-kappa beta overactivity. This NF-kappa beta has various functions. One of its function is the development and differentiation of various cells. One among those cells are the osteoclasts. Due to its NF-kappa beta overactivity, there will be an increased in osteoclastic activity which causes increased bone resorption. Not only secostosome 1 gene mutation, there are also other genetic factors which causes Paget's disease. The first comes is the rank mutation. Rank, this is actually a receptor which normally causes increase in osteoclastic activity. But there will be an order in its function during normal conditions. But when mutation occurs, there will be an increased osteoclastic activities heavily which causes heavy reabsorption of bones. The next comes the osteoprotegerin mutation, that is OPG gene mutation, which causes increase in osteoclastogenesis. This osteoclastogenesis is nothing but production of osteoclasts. When there will be an increased osteoclastic production, what happens? There will be an increased resorption of bone which will lead to Paget's disease. Now let's see about the infectious causes of Paget's disease. The most common infection occurring is the viral infection and the most common virus is the RNA virus and the most common RNA virus is paramyxovirus, which will cause a slow viral infection. That is, it may take at least some months to some years for the disease manifestation to occur. Then coming to the morphology, there are three stages involved in this disease. The first is the initial osteolytic stage. The next comes the mixed osteoclastic osteoblastic stage. The last one is the quiescent osteosclerotic phase. Now let's see about the first stage, the initial osteolytic stage. As the name suggests, there will be an increased osteolytic activity. Now recall about the cell which causes this osteolytic activity. Yes, the osteoclasts. Their number will be increased in this stage, which causes increase in bone absorption, which weakens the bone. The second stage is a mixed osteoclastic and osteoblastic stage. As the name indicates, there will be osteoclastic activity also, and there also will be osteoblastic activity, which causes increased resorption of bone and formation of new bone, respectively. Okay. Then there will be a prominent cement lines which will produce a mosaic or jigsaw appearance. You can see this diagram. Can you appreciate a mosaic appearance over this diagram? Okay. Normally there will be 10 to 12 nuclei in the osteoclast, but there will be an increased abnormally large number of nuclei, that is up to 100 nuclei will be present in a single osteoclast. The third stage is the quiescent osteosclerotic phase, where there will be excessive bone formation which will lead to the sclerosis of bone. This will lead to poor mineralization of bone, so the bones are prone to excess fractures. In X-ray, you can see this as a cotton wool appearance. I have displayed a diagram in next slide, don't worry. This is the skull of a person with Paget's disease. You can appreciate excellently, I can say, you can appreciate excellently the cotton wool appearance, that is thready appearance you can see now, here and there. This is the diagram of a bone with Paget's disease. In the first stage, that is the osteolytic phase, you can see only osteoclasts, that is bone reabsorbing cells are only present. And the next phase, mixed osteoclastic and osteoblastic phase, during which both osteoclasts and osteoblasts are present. And the next comes the osteosclerotic phase, where there will be only osteoblasts, there will be more bone formation, and there will be poor mineralization, which will lead to fracture of the bone. Now coming to the clinical features, there may be involvement of a single bone which is monoosteotic or more than one bone which is polyosteotic. Now the location where this disease commonly affects are the axial skeleton like skull, ribs, vertebra, etc. and the appendicular skeleton like femur, humerus. Particularly it affects the proximal part of the femur. Now let's see about the clinical features of the axial skeleton. The patient's face will be looking like a lion, which is known as the leontiasis osseosa, and the patient will be unable to hold his head erect. Next comes the platyphasia, which means there will be invagination of the base of the skull, and there will be compression of the posterior fossa of the skull also. And there will be vertebral compression also, which will lead to spine injury and kyphosis. Spine injury will eventually lead to spinal nerve injury. So there will be neurological complications also. See the face of the female patient with leontiasis osseosa. She is having Paget's disease. Then now, observe this normal X-ray and then see this abnormal X-ray with platyphasia. Only when you observe this normal X-ray, you will know to differentiate what is abnormal in this X-ray. Okay. This is the image of a vertebral compression or the kyphosis. Coming to the clinical features of the appendicular skeleton. For a weight-bearing bone, it will show bowing, which means bending of the bone, and it will produce a characteristic fracture known as the chalk stick fracture, which means there will be a fracture in its transverse plane, which will be more looking like a breaking a chalk stick. Now see this normal image and this X-ray image. You can see the bending of the weight-bearing bone, that is the tibia. Now coming to the complication of the Paget's disease. Paget's disease will lead to osteoarthritis. This is the bone complication. It will also lead to systemic complications like the cardiac failure. On long-standing infection, it may produce osteosarcoma. I have made a video on osteosarcoma. I will provide the link in the description. You can click it and watch it. Now coming to the diagnosis. We can diagnose Paget's disease through X-ray image, where we will be seeing wedge-shaped lytic leading edges due to poor remodeling of the bone. This will progress along the length of the bone fully, and there will be increased serum alkaline phosphatase level also. Now coming to the treatment part, we can treat Paget's disease with calcitonin. Calcitonin helps in the treatment of Paget's disease because it inhibits the osteoclast. Because of that, there will be less resorption of bone and the bone will be orderly remodeling. Then we can also use bisphosphonates. Bisphosphonates, particularly zoledronate, is effective against Paget's disease. This brings the end of the topic Paget's disease. I have made detailed notes on this topic in our Telegram channel, medicaldafossa. You can make use of those notes and you can revise for your exams. Thank you.